Do you know what the number one leading cause of death for Americans aged 18 through 45 is? Is it cancer? Is it heart disease? Diabetes? Well, no. What if I told you that the most prevalent cause of death impacting young Americans today is actually fentanyl overdose? My name is Charles Simonian, and today I will seek to help educate you on the opioid epidemic and present my literature analysis regarding the impact of sociological factors on overdose. But first, I would like to share with you some background information about myself. I am a rising senior at Furnace Prep High School in La Cañada, California. Some activities I'm involved in include my founding of an organization called Semi Supplies, which has grown into a statewide not-for-profit supplies and Narcan distribution platform. I also serve as an ambassador for Song for Charlie and the LA County Department of Public Health in my effort to help combat the opioid crisis. I also volunteer in the rural town of Tejutla, Guatemala each summer, and this summer I will be researching mental health in that region. I generally enjoy the study of public health. Now I would like to give you some background information on the opioid crisis before I delve into the intricacies of my research. So, what are opioids? Well, opioids are a class of drugs that are derived from or mimic the substances found from the opium poppy plant, as you can see here. There exist different variations of opioids. Natural opiates include morphine. Semi-synthetic opioids include heroin and oxycodone, while synthetic opioids include fentanyl, which is up to 100 times more potent than morphine. To the right, you'll see a laboratory in which synthetic opioids are illicitly manufactured. All opioids essentially perform the same function of activating nerve cells in the brain and the body to block pain signals. People using opioids can develop physical dependence or addiction, and opioid use disorder can arise, leading to risks of overdose and death. So as you can see, the opioid use can be very dangerous, especially if the drugs are abused inappropriately. Now I'd like to give you a brief global summary of opioids and how we got to where we are today. For centuries, opioids have been used as medicines to manage or treat pain in patients. Even starting 8,000 years ago in ancient Sumerian civilization, opioid use existed. Throughout time, opioids have been globally used for pain treatment, and as a result of this use, widespread addiction and overdoses have become especially prevalent. Now for some global figures. So as we can see by these figures, although a disproportionate amount of the world's opioid crisis exists within the United States of America, plenty of other countries are heavily affected as well. To the left, we see the opioid use disorder death rates per country. To the right, we see red bubbles approximating the relative percentages of people abusing opioids per country. For the last bit of background education on the opioid crisis, I believe it is imperative to speak about the antidote to an opioid overdose, and that is Narcan, also known as naloxone. Narcan is an opioid overdose reversal medication that commonly functions as a nasal spray, as shown to the right. It safely and effectively reverses the effects of an overdose by nasal application. Now I'd like to shift focus into my in-depth literature review, which covered 71 distinct articles and were narrowed down to 29 articles to determine the impact of sociological factors on the opioid crisis. I conducted a literature review using articles from the ScienceDirect platform in an effort to truly comprehend this relationship between society and sociological factors and its impact on the opioid crisis and the high overdose rates that America is experiencing today. My methods included using strategic search terms to uncover articles of interest on the ScienceDirect platform, and I limited the scope of my article search to 1995 to 2023. As for the discussion section of my paper, I aim to articulate a comprehensive understanding of the opioid epidemic across sociological factors, and I observed 5 specific sociological barriers to accessing care that impede Americans from finding addiction or overdose solutions. These observations do not consider race and are the same across all demographics in America. The first is stigma. The studies I observed illustrated internalized stigma from shame about drug use as a barrier to seeking care. Racism and bureaucracy contribute to these stigmas as well. The second is fear of police. A fear of police intervention and repulsion towards law enforcement is harmful as this prevents lives from being saved in times of crisis. Namely, in Baltimore, Philadelphia, and New York City, multiple studies pointed out negative perceptions of law enforcement. The third is education. A lack of education regarding individual protections and general opioid knowledge can prove devastating, especially to communities affected by opioid use disorder. Generally, the American public is not very well educated on recovery options as well as opioid knowledge. The last regards Narcan, and is split into two categories of Narcan stigma and Narcan availability. Narcan stigma is one that I found most interesting, and it relates to the stigma towards Narcan acquisition. There is an underlying fear that doctors would stop giving patients pain meds if these patients acquired Narcan from the pharmacy, leading to Narcan stigma and an increased unwillingness to receive Narcan. As for availability, there exists a lack of innovative Narcan distribution methods and platforms, leading to barriers for accessing care. Now, to conclude my findings, I would namely highlight that the most prevalent sociological indicators for overdose and addiction serve as barriers to accessing care, and these include stigma, fear of police, education, and Narcan. I also did analyze previous interventions and overdose prevention methods that were cited across these articles and have been tested across America, and here they are below. Now, to conclude my presentation, I would like to explain some of the work that I have done in the field of harm reduction, which has been inspired largely by learning about a lack of Narcan access and associated stigmas in America. Over the past year, I've acquired 2 grants from California's Department of Healthcare Services for 580 units of Narcan, and I've been distributing them through Narcan vending containers across LA. These containers increase Narcan availability and address the stigmas associated with Narcan acquisition through the power of anonymity. I am proud to say that this initiative has saved at least one life. My initiative aside, though, I would like to truly emphasize the amount of work that can be done in effort to reverse the opioid epidemic. Research and education are a start, but taking action is the fundamental next step. I truly hope you're able to learn something new from this presentation. Hopefully, I inspired you to try to find Narcan for yourself or for your community, as you can never go wrong when you prioritize safety. Here are my references. I would like to thank California's Department of Healthcare Services, my family, and the Johns Hopkins University Global Health Leaders Conference for this amazing opportunity. Thank you. And here's my contact info.